on this conflict for causing the most number of civilian casualties. So they want to find a way out. The question is, will the Houthis and the Saudis be able to agree on the elements to give Saudi Arabia the security on its border it wants, to make sure that Iran, its arch rival, does not have a launching pad in Yemen? And the Houthis want to really maintain their grip on power, so there's still a long way to go.
Lise Doucette there. Concerns are rising that the coronavirus pandemic could set off a humanitarian crisis in Idlib, the last battlefield in the Syrian war. A shaky ceasefire is holding, but aid organisations warn the province is wholly unprepared for an outbreak. Here's Deutsche Welle's Esther Felden.
What's it like to live in Idlib? In constant fear of Assad's approaching forces, in constant fear the aerial bombardments will resume. For weeks now, 26-year-old student Zaha Zatoa has been sending us her impressions, images from the last rebel-held city in Syria, where the coronavirus is on everyone's lips.
I am taking it seriously, but it's difficult. When I go outside, I try to wear a mask and gloves. I worry that my family or I will get infected.
The ceasefire has been holding in Idlib for 4 weeks now. The city is coming back to life, and the streets and markets are bustling. But just as people savour the sweet taste of freedom, the threat of the coronavirus is looming.
In other countries with the coronavirus, people are cocooning at home. Here in Idlib, nobody is taking the danger seriously. Everyone's going shopping. Nobody is taking any precautions.
In the refugee camps around Idlib, the coronavirus seems a distant threat too. Hundreds of thousands of people live here in dire conditions. Essential health measures such as keeping a safe distance or washing hands are impossible in many of the camps. Health workers are trying to raise the alarm however they can.
You all have to understand how dangerous the situation is. We as doctors have extremely limited means at our disposal to tackle this pandemic.
Dr. Kador is an anesthesiologist and general manager at one of the few hospitals still operating in Idlib province. He's trying to prepare the clinic, even though it only has 2 intensive care beds and a single ventilator. There are only 95 ventilators for the whole region, with a population of more than 3 million. Dr. Kador says it could get worse than in Italy.
Soon we will have to make some really terrible decisions here. Who should get a chance to live and who should we let die? Because we have no people, no gloves, and above all, no ventilators.
The clinic staff posted this photo on Facebook. We'll stay here for you, you stay at home for us. But the appeal has fallen on deaf ears. Saha too has stopped wearing a mask when she leaves the house. She says she can't stand being stared at and laughed at anymore. In Idlib, more tough times are ahead.
Esther Felden reporting. Brazil's health minister says the government is planning to build a field hospital for indigenous communities after the first case of COVID-19 was confirmed in the Yanomami Reserve. A 15-year-old is reportedly in intensive care. He's one of 7 indigenous Brazilians to test positive for the coronavirus in 3 Amazon states. The president of Belarus, Alexander Lukashenko, has resisted calls for a nationwide lockdown amid the pandemic, suggesting that vodka or a sauna would help against the disease. So whilst football fixtures across Europe have been stopped for safety reasons, Belarusian teams are playing on. But with almost 900 coronavirus cases already confirmed, local supporters are increasingly abandoning stadiums. Alexei Kalashuk is a Dynamo Minsk fan and told the BBC he loves his football team, but he's worried about people's health.
Our president maybe decided to ignore the situation and pretend that nothing is going on serious. So the leaders of our football decided to keep playing. We're not the first country in the world that faced the virus. So Italians laughed off the virus first, but then it went worse and worse. I'm afraid that this attitude of our authorities and our people could lead to the same result.
Alexei Kalashuk speaking to the BBC. In New York, the epicenter of the outbreak in the US, another 800 people died in the last 24-hour period. At the same time, the rate of infections is flattening, leading to fewer hospitalisations. The state's governor, Andrew Cuomo, says that's good news, but he's urged people to stay vigilant.
If we continue doing what we're doing, then we believe the curve will continue to flatten. But it's not a time to get complacent. It's not a time to do anything different than we have been doing. Remember what happened in Italy when the entire healthcare system became overrun? So we have to remain diligent. We have to remain disciplined going forward.
Andrew Cuomo there. Staying in the US, and Bernie Sanders has bowed out of the race to be the Democratic nominee in this year's presidential election. The senator from Vermont says for him the path towards victory is virtually impossible. The ABC's David Lipson reports.
Good morning. A sign of the times, a live stream, no audience, no media, as Bernie Sanders addressed his loyal supporters directly.
I wish I could give you better news, but I think you know the truth.
Pointing out he's 300 delegates behind his Democratic opponent, Joe Biden, the 78-year-old senator said now was not the time to fight on.
As I see the crisis gripping the nation, exacerbated by a president unwilling or unable to provide any kind of credible leadership, and the work that needs to be done to protect people in this most desperate hour, I cannot, in good conscience, continue to mount a campaign that cannot win.
He congratulated Joe Biden and promised to support him, but warned he wasn't giving up quite yet on his democratic socialist policy agenda, pointing out the name Sanders will remain on the ballot in all remaining states and urging his supporters to put an X beside it.
While Vice President Biden will be the nominee, we must continue working to assemble as many delegates as possible at the Democratic Convention, where we will be able to exert significant influence over the party platform.
In a statement, Joe Biden didn't thank Sanders, but he did commend him for pushing once fringe issues to the centre of debate: income inequality, universal healthcare and free university, to name a few. Joe Biden is the embodiment of the Washington establishment Sanders has railed against for years, and the most powerful outsider of all, Donald Trump, knows it well. On Twitter, the president sought to sow division. This ended just like the Democrats and the DNC wanted, he wrote. Same as the crooked Hillary fiasco. The Bernie people should come to the Republican Party. The president's nightly coronavirus briefings attract millions of viewers, but support for his handling of the crisis appears to be slipping. Amid the pandemic, Joe Biden struggles to get airtime. The coronavirus has humbled America, painfully revealing its many weak spots: poor healthcare, rampant inequality, sluggish bureaucracy, and all-pervasive politics. The election will turn on who's best suited to lift a great nation off its knees.
David Lipson reporting. Sudan has doubled the price of bread in the capital Khartoum from £1 per loaf to £2. Although the government pays 3/4 of the cost of the flour they use, bakers have threatened to go on strike over rising operating costs and the falling value of the Sudanese pound. High prices last year triggered mass protests, which led to the downfall of President Omar al-Bashir. Some musicians have been trying their best to lift spirits around the world. One of them is a 7-year-old child prodigy from Greece who composed a song for those feeling alone under the lockdown. The BBC's Merlin Thomas has more.
That's the sound of Stefios Karasidis performing his own composition, Isolation Waltz, for a world in lockdown. The 7-year-old had this message for the world: let's all be a little bit more patient, and soon we'll all be able to go outside and go swimming in the sea. Stelios first performed in public at the age of just 3. Since then, the award-winning pianist has played all around the world, from New York's Carnegie Hall to London's very own Albert Hall. In a time of such uncertainty, music is a grounding force that brings us all a little bit closer together. Move over, Mozart. There's a new kid on the block.
Absolutely, and that's World Watch for today. Back to you, Marnie.
Thanks, Annabelle. And that's Midday Report, Te Pūrongo o Te Pōtūtanga for Thursday, April the 8th. Stay with RNZ. We'll have today's COVID-19 briefing shortly after 1. Our team will be back on Tuesday after the long weekend. Have a great Easter. Kia hau maru te noho.
RNZ News at 1. Good afternoon. Ko Kainwin Curtis aho. The Prime Minister and the Director General of Health are about to give a briefing on the coronavirus. And they're now crossing... No, we'll carry on. And the Director General of Health are about to give a briefing. We'll cross to that as soon as it begins. But first, our top stories. 2 nurses from Waikato Hospital have tested positive for COVID-19. Waikato DHB Chief Executive Kevin Snee says the nurses both work in the same ward and were stood down immediately upon developing symptoms. Other staff who were working in that ward between March 31st and April 6th have also been stood down as more information is gathered about the nurses' movements. There are currently no patients confirmed to have COVID-19 in the ward, which primarily provides care to people older than 65. Dr. Snee says the 2 nurses acted in line with DHB policy, and there's only a small chance of them having passed on the virus. A review into the Earthquake Commission says the organisation was completely unprepared to deal with the large-scale damage wrought by the 2010 and 2011 Canterbury earthquakes. The findings of the inquiry into the Commission and its handling of quake claims in Canterbury and Kaikoura have finally been released. The inquiry chair, Dame Sylvia Cartwright, lays out a raft of inadequacies at the EQC, from it not having systems in place to log inquiries to failing to properly assess quake damage. She says she has grave concerns about the quality of the housing stock in Christchurch and Kaikoura, and says a lot of damage may not have been picked up until people attempt to sell their homes. She's also worried about the large number of damaged homes given cosmetic repairs and on-sold to unsuspecting buyers. A recommendation to potentially remove the $150,000 cap would see EQC pay out the entire amount a home is insured for. These and other recommendations will now be considered by the government, which is promising a review of the legislation next year. Consumers dramatically changed their spending patterns last month because of the COVID-19 virus and government-ordered lockdown. Official numbers show overall retail spending using electronic cards fell a seasonally adjusted 3.9% on the previous month. But the amount spent on eating out and accommodation fell nearly $340 million, about a third. Stats NZ says that was offset by a $315 million increase in supermarket and groceries, an 18% rise. Liquor sales rose 15%. Big-ticket items such as appliances, clothing and fuel and vehicle spending were all markedly lower. The numbers include sales on credit and debit cards and cover about 2/3 of retail spending. More than 36,000 people in Christchurch could lose their jobs due to the coronavirus pandemic. The grim figures were released by the city's economic development agency, Christchurch NZ, this morning. The agency says the city's gross domestic product could fall by more than 17% as a result of COVID-19. It says work is underway on an economic support package which includes rates relief for businesses and residents and grants of up to $5,000 for businesses. It says the city's economic recovery will be organised into 4 streams: a business support package, infrastructure-led recovery, economic development and a community and visitor program. People are queuing around the block at supermarkets throughout the country as they prepare for the long weekend. Kerry Hannafin from Woolworths NZ, which owns Countdown, Fresh Choice and SuperValue supermarkets, says people are frustrated but remaining pleasant. She says at one Auckland store today there were long queues 2 hours before it had opened. Ms Hannafin says most of their stores will be trading on Easter Sunday and there's plenty of food to go around. The police are appealing for information after a woman in her 60s was assaulted while walking at the weekend. The woman was walking along Puriri Avenue in Oriwa about 9:15 on Sunday evening when she noticed a man behind her. She quickened her pace but was followed for at least 350 metres before being assaulted on the corner of Parkside Drive and Puriri Boulevard. Inspector Mark Fergus says the woman managed to run away and was injured but understandably shaken. He says it appears to be a random attack and police want to hear from anyone who has a CCTV camera in the area or was on Puriri Avenue that evening. That's the news.
Right, we're starting with narrative appreciation, then reading, writing, spelling.
Then a story.
After our contextual cultural development studies, we move on to understanding your place in world history by developing a growing appreciation of myth and legend.
Then a story.
Then we'll move on to developing empathy through imaginative experience and...
Story.
Through walking in other people's moccasins? I don't like the sound of that.
Let's just have a story.
Yes, let's.
Yippee! Story time.
A wealth of stories on tap day and night in the Best of Storytime podcast. Find it on the podcast page of the RNZ website at rnz.co.
Good afternoon, everyone. Welcome to day 15. I'm going to start by handing over to Dr. Bloomfield to give us an update on our latest case numbers. Then we'll come back to me and I'll be giving a slightly longer scene setter, given the milestone that we've reached recently with lockdown at alert level 4. So, Dr. Bloomfield, I'll hand over to you.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 29 new cases of COVID-19 to report, and this comprises 23 new confirmed cases and 6 probable cases. There are no additional deaths to report. However, we do have 14 people in hospital, and that includes 4 in ICU. They are in North Shore, Middlemore, Dunedin and Wellington regional hospitals. We now have 317 reported cases of COVID-19 we can confirm have recovered. That's an increase of 35 on yesterday. So today's number of recovered cases at 35 is higher than the number of new cases at 29. And the combined new total of confirmed and probable cases is 1,239. For the cases we have information on, we've still got the strong link to overseas travel, 41% of cases. That continues to decline. 44% are contacts of other cases in New Zealand and 2% are community transmission. 13% of cases are still under investigation. We still have the 12 significant clusters, and the 3 largest are at Matamata with 64 cases, the Bluff Wedding with 87, and the Marist College cluster with 84 cases. In terms of laboratory testing, yesterday there were 3,990 tests processed, and the total number of tests undertaken to date has increased accordingly. I'll just find the correct number there. So our 7-day rolling average of tests is 3,547 per day. We still have good test capacity, and that continues to increase as supplies come in as expected this week. Just a quick word on the clusters. We've talked about those a little yesterday. We do take a particular interest there because when we have a cluster, either in a place, geographical place, or at an event, or in a particular location like a workplace or a school, there is the potential for quite rapid spread there. And our intention is then to try and ring fence those clusters as quickly as possible and stop any further spread. So we do know that our ability to contain those clusters has been greatly enhanced because we are in the alert level 4 lockdown situation. So we're confident now that we are on top of those clusters and that any additional cases are largely within bubbles within each of those clusters. We've also worked to streamline information flows between the district health boards, ourselves and ESR to ensure we're able to get on top of those clusters, to contain them, to get good information about the timing of the onset of symptoms and of diagnosis of new cases, and also the proportion of close contacts that we are successfully tracing. And just to help sort of reassure me about that contact tracing system, I've asked infectious diseases specialist Dr. Aisha Varel to do a rapid review of that today. I'm meeting with her later in the day and look forward to getting her views on how robust our process is and whether there are any improvements we could make to it. And finally, just on flu vaccination, we've now distributed over 1 million doses of the vaccine around the motu. They are in general practices, pharmacies and in district health boards. There are good supplies in every region. I have looked at the figures. We have sufficient vaccine for all our priority groups, and I encourage those people to call their GP or their pharmacy and make a time to go in and be vaccinated. And Associate Minister, Health Minister Julianne Genter announced earlier today we are extending for 2 weeks out to the end of April the time for those priority groups to be vaccinated, and those who are not in priority groups just to wait until after that time to get their vaccination. And finally, please, if you have any health conditions that you require care for, either acute care or you have a chronic condition that requires care, you contact your usual healthcare provider or talk to Healthline if it's an acute condition. We really want people to keep showing up for and seeking care that they need and not delaying care so that they end up being worse off. So that's all I have to say. Prime Minister, back to you.
Thank you, Ashley. Today is day 15 of Alert Level 4 lockdown, and at this rough halfway mark, I have no hesitation saying that what New Zealanders have done over the last 2 weeks is huge. In the face of the greatest threat to human health that we have faced in over a century, Kiwis have quietly and collectively implemented a nationwide wall of defence. You are breaking the chain of transmission, and you did it for each other. As a government, we have had pandemic notices. We've had powers that come with being in a national emergency. But you held the greatest power of all. You made the decision that together we could protect one another, and you have. You have saved lives. Modelling provided to my office by economist Rodney Jones on the eve of the lockdown suggested New Zealand was on a similar trajectory to potentially Italy or even Spain, and that our 205 cases on the 25th of March could have grown to over 10,000 by now without the actions we have taken together. And new modelling, due to be released later this afternoon by Te Pūnaha Matatini, suggests that the current controls at Alert Level 4 have already had a significant impact on new case numbers, and we are on track to meet their most optimistic scenario. Instead of the horrific scenes we've seen abroad, we are at 1,239 cases, and the total number of cases has fallen for the last 4 days, was, as Dr. Bloomfield said, just 29 cases today, the lowest daily number of cases since the 23rd of March before the lockdown began. We are turning a corner, and your commitment means our plan is working. But to succeed, we need it to keep working. Success does not mean we change the course. Removing restrictions now would allow the virus to spread rapidly once again, and we would be back to the starting line within 2 weeks. That's also why we will keep enforcing the rules. In addition, you will have seen an increase in police enforcement in recent days. I expect that to continue, including roadblocks in some places this Easter weekend. While most are doing the right thing, some are not. We cannot let the selfish actions of a few set us back, and we won't, especially after all that everyone has sacrificed to get us here. I've read messages from those who have lost loved ones that couldn't come together to grieve for them. I've read stories of brand new parents whose most joyful time has been made so difficult because of separation. Businesses who are worried for their livelihoods and for the family that are their employees. I am acutely aware of the pain many New Zealanders are feeling. Over 1 million of our fellow citizens are now supported by a wage subsidy, many of whom will be experiencing a cut in income. At the end of March, there were already an extra 4,866 Kiwis on a benefit, and last week that number increased by another 10,000. Many businesses are also reporting that they may not be able to reopen at the end of the lockdown. I want to give you all the assurance that I can that the health and well-being of you and our communities has always been on our minds as we have made decisions on COVID-19. But so has your livelihoods. We will continue to stand alongside you. We've made record investments to keep as many businesses as possible afloat and people in jobs. We're doing what we can to cushion the blow and plan for our recovery. but as I've said, this is going to be a marathon. Our plan for that marathon is to keep eliminating the virus from New Zealand. We can do that by keeping it out of the country, but also by rapidly stamping out any outbreaks that flare up. And that plan is the very best thing that we can do for the New Zealand economy. The best economic response continues to be a strong health response. And that's why I'm announcing the next stage of initiatives to scale up our health response to put us in the best possible position to exit level 4 and prepare for level 3. No matter what level we are at in the future, there are 3 areas where we need to become watertight. Firstly, our borders must be tightly managed. That's why from midnight tonight, every New Zealander boarding a flight to return home will be required to undergo quarantine or what we have called managed isolation in an approved facility for a minimum of 14 days. I'm also signalling that the requirement for 14 days of quarantine or managed self-isolation in a government-approved facility will be a prerequisite for anyone entering the country in order to keep the virus out. As an island nation, we have a distinct advantage in our ability to eliminate the virus, but our borders are also our biggest risk. As a government, we have gone harder earlier with border measures compared to other countries. But even one person slipping through the cracks and bringing the virus in can see an explosion in cases, as we have observed with some of our biggest clusters. The quarantining of returning New Zealanders will be a significant undertaking. For context, nearly 40,000 New Zealanders have returned home since the 20th of March, when we closed the border to foreign nationals. That is more than all of the hotel rooms across the country that we could have properly housed people in. There has always been urgency around this matter, but simply put, we could not have done it from the beginning. But we can and are doing it now. A network of up to 18 hotels will be used to implement this approach, of which 1 to 2 will be specifically set aside for those under strict quarantine conditions. And just as a reminder, those are for those travellers who are symptomatic or are being tested for COVID-19. The second aspect of our ongoing COVID response is significantly scaled up and faster contact tracing and greater use of technology. The more we move to improve the speed and effectiveness of our contact tracing, the better place we will be in breaking the chain of transmission. The Ministry of Health is already working on a locally developed app that will assist with contact tracing. I should caution that it is in the early stages. It will have basic functionality, but even that will be important as it will help update our national health database with users' contact details. Then they will look to add functions. We are investigating the Singaporean government's Bluetooth-based app Trace Together that can record interactions between a phone and any other phones nearby that have the app installed. I should caution, though, that it will often pick up phones at quite a distance, so it's not perfect technology. The data is stored on the phone, and if the user tests positive, they then release the data to the government for contact tracing. Close contacts can then be automatically notified if they need to self-isolate and be tested. Singapore are planning to open source their technology in the next few weeks. We have made initial contact with the Singaporean government and registered our interest. And I have a phone call with Prime Minister Lee of Singapore this evening where I'll be discussing this technology further. I do again think it's important to note that these kinds of apps are useful, but they don't solve everything. What's most important is that you have good people and enough people working on contact tracing as quickly as possible. We do, and we continue to improve and work to improve every day, as Dr. Bloomfield has set out. And finally, this ongoing plan must be underpinned by testing. We already have incredibly high rates of testing compared to others, but we want to be even better. We will be maintaining high levels of testing and supplementing it with additional testing to ensure we have greater levels of certainty around the decline in the virus's spread. With these 3 pillars, border controls, rigorous testing and contact tracing, and making sure, of course, that we use all the technology available, we have what we need to win this marathon. But I know in a race it's important to have signposts, to know where we are and exactly what we need to do when we get there so we can all have a plan. Let me set out some of the timelines then for some key decisions that will affect everyone. Level 4 has come with some heavy restrictions. That has required difficult decisions around services and businesses that can and cannot operate. We need to give similar detailed guidance on what life at Level 3 looks like, and we will do that next week. That will give us a window to iron out questions and issues and make sure we're as prepared as we can be when it comes time to eventually move. It is then my intention that on the 20th of April, 2 days before the lockdown is due to finish, Cabinet will make a decision on our next steps. That's because we need to use the most up-to-date data that we have to make that decision. That means if we are ready to move to Alert Level 3, business will have 2 days to implement arrangements. But let me say again, we will not be moving out of Level 4 early. If we move too early, we will go backwards. In the meantime, I ask every business to use the time you have to prepare for what every alert level means for you. Treat COVID-19 like a health and safety issue. Ask whether it's possible for your business to operate with social distancing. Can you build in contact tracing tools or mechanisms to keep track of your supply chain and customers? Help us get ready as a nation for the marathon that we must run together. I do know that we can do this, and I know that because we are already. So as we head into Easter, I say thank you to you and your bubble. You have stayed calm, you've been strong, you've saved lives, and now we just need to keep going. Happy to take questions.
The government's always maintained that between kind of 7 and 10 days, or at least the halfway mark, we'd have a sense of whether we'd be coming out of lockdown or not. Is the uncertainty that's killing a lot of businesses. So 2 days out from the lockdown lifting, is that enough time? And then what sense can you give us of what Level 3 looks like? What kinds of businesses will be able to open again?
My message to businesses now is prepare now. Prepare now for every alert level. You will be getting the data that we're making our decisions on in real time. And only a few hours after we receive it. But we need to make sure that we don't move too early. If we do, we risk losing all of the gains we've made.
In the mandatory quarantine, what will that look like for people who are there? Are they going to be able to leave at all, and for what reasons, and how will they be supervised?
We already have, so just to give you the clear distinction between what we're operating, and we're operating this already, but what's different is now everybody who arrives will either be put into quarantine or into what we're calling assisted self-isolation. Both are utilising at present hotels. The difference with quarantine is that's where our people who are symptomatic or being tested for COVID-19 go, and they cannot leave their rooms. They must stay where they are. Someone in assisted self-isolation is able to leave their room for walk or fresh air, but nothing else. So they are very similar. Do you want to add anything on that, Dr. Bloomfield, on those distinctions?
I think just on the latter, Prime Minister, recall when we brought the flight back out of Wuhan and we had people up at Whangaparaoa. The latter group is like that. So yes, we'll make sure they are looked after so they are not putting themselves or others at risk, but yes, they will be able to get outside for fresh air and do other activities. They're not confined to their rooms.
Why have you decided not to quarantine everyone as Australia is doing?
Oh, just to be really clear, just a bit of background, we essentially are. Everyone who now comes into the New Zealand border must go into a hotel that is being provided by the New Zealand government. They cannot go home for 14 days. So essentially they are. The reason we just use the word quarantine is it comes with different legal powers. And so quarantine is applied to those who are symptomatic and being tested for COVID-19. But to be absolutely clear, no one goes home. Everyone goes into a managed facility.
Certain that no one available at those facilities.
At the moment, we're utilising the skills of public health to particularly monitor those who are symptomatic, and we're also using the police to monitor the facilities. And there is a reason also why we've been using particular hotels. We need to make sure that we can keep them secure And of course, we've got the ability to keep an eye on people's movements within the hotel. And also, it means that we can have people in the same facility without being in contact with each other. So these are all assessed to make sure that we can keep people safe and distant from one another. And those are the kinds of hotels that we're choosing. Sorry,
how
follow-up
long
question?
are you planning for this regime at the border to be in place?
There is no endpoint as yet. As I've said, this will be a marathon, and our borders will continue to be a high risk element for New Zealand. We benefit from a very large moat, but we need to make the most of it and manage and assess every single person who is coming into the country. I cannot give you an end date for when that will cease.
The number of people arriving has been 300 or fewer over the last week.
It has.
Why not implement it a week ago?
Sorry, what was that?
Why not implement this a week ago?
Well, of course, we have been operating this system for some time. We already have roughly 1,000 people in motels, 90 on top, 155, forgive me, on top of that, who are considered in formal quarantine. So we have already been operating the system. Now it's operating for everyone. You would have heard from the numbers I gave, we have for a significant amount of time had a large number of people coming through, 40,000 more than we could have accommodated. Now we have more consistent numbers, and so these rules will apply for everyone.
The lockdown's having a significant impact upon the economy. The benefit numbers showed us that today. To what degree will the impact on the economy factor into the decision-making process about when to lift the lockdown?
And it already does, because the best thing we can do for our economy is get our health response right. And that is how we stop ourselves from being Italy, from being Spain, from being the UK, who have had to have extended periods of lockdown, which then has a significant impact on the economy. The sooner we get on top of the virus and have control of it, the sooner we can start lifting some of those restrictions and help get our economy moving again.
Will Kiwis at the border have to pay for the hotel rooms?
At this point, because we've wanted to move with speed, the government will be providing these facilities. But we will continue to do work on how we manage border controls over the coming weeks and months, because they are likely to be a part of our system for some time to come. So we have not ruled out using things like co-payments to provide that in the future, but for the sake of getting this up and running now, we have moved to provide it. Sorry?
Will the Defence Force be used to enforce the quarantines?
At the moment, we've been using the police, but we've always been open to using a range of different enforcement forces in order to bring surety to New Zealanders that people are doing what they're meant to. Keeping in mind as well, in these hotel facilities, we can keep an eye on people's movements. They have security arrangements attached to them.
Can I just ask, it's a stunning number today, a stunning drop. How likely is it that these sorts of numbers are the numbers we're going to see in the days forward, or do you think there's potential for a spike?
It's hard to predict the future, I've found, but it is encouraging. As the Prime Minister said, this is the fourth day in a row where we've seen a drop day on day, so we're expecting the numbers to continue to stay low. There may be the odd bump up and down, and we know we still are finding and confirming the odd case from some of the clusters. Those we are hoping will be the mainstay of our additional cases. The important thing here is those lab testing numbers, and our intention, as the Prime Minister said, to keep testing widely to be sure that we are finding any cases. So very wide testing of anyone with influenza-like illness symptoms.
Will the government commit to deleting the data raised from this app? Will the government commit to deleting all the data that's raised from this app when the pandemic is over?
Well, ultimately it would be around how long you are trying to manage COVID-19 generally. But I can be very clear that the only reason we would be utilising the app is to manage outbreaks of COVID, and it would only therefore be a tool that would be used by health for health purposes. I had explained to me last night that health is working very closely with those who need to make sure that we're overseeing privacy concerns. So they're reaching out to the Privacy Commissioner and to those who may have security concerns.
People have some sort of, I suppose, veto over their personal information.
They would choose whether they have it or are a part of it. So that's been the feature of many of the countries who have used these apps. They've been voluntary. But I have to say, for it to be successful, we would need wide uptake. So we would really need the public to buy into the idea that this will help protect them and protect their families. Actually, did you want to add anything on the app?
Just that we're very careful about, in any of these developments in health, to balance up people's privacy issues and their confidence that their health information or any information about their health is being safeguarded and only used for that purpose. So we will apply the same level of rigour to these developments.
Prime Minister, not being able to attend tangi continues to be an area of distress for Māori, given that the parameters for what qualifies as an essential item or essential workers looks to be being adjusted as we go. Why not have restrictions around tangihanga instead of a blanket ban for those outside of the bubble? Have restrictions around things like hygiene, a cap perhaps of maybe 10 people. Why not restrict it to protect whānau instead of a blanket ban and trust whānau to stick to that?
One of the reasons is that in all of the assessments we've made around what is essential and not, it's all come down to how do we limit everyone's contact with one another to the bare minimum. And so there are some parts of our lives where actually contact is just built in. And if you look at the areas where we have clusters of cases, they're just a slice of life in Aotearoa. They're weddings. They're functions where loved ones have got together before weddings. They're rugby teams. They're social occasions, because that's when we're really physically close to one another. And so that's where we haven't been able to let any room for that kind of contact to happen. And I know how horrific that is for tangi. I've watched friends who have had to go through funerals through live streaming, and that just feels wrong for New Zealanders. But it's the only way that we can protect one another.
But the government, though, Prime Minister, has shown some trust in New Zealanders, like people returning from overseas in weeks past to self-isolate at home. There's a trust there for New Zealanders to follow the rules. Why not trust people to follow the rules and parameters set by the government for tangi?
Because the rules are stay away from each other, not come in contact with one another, not interact with anyone who's not in your bubble. And that fundamentally goes against everything that tangi is about. And so that places a huge burden on anyone who would be holding a tangi for a lost loved one or a funeral. So if someone you've lost is in your bubble, you can be there for them. But for anyone else, we just haven't been able to let that in, because that ultimately could lead to other people becoming ill.
So the passing of esteemed Māori leader Huirangi Waikerepuru, what do you know of his contribution to New Zealand, and what words do you have for the whānau?
I'm so sorry that people are losing loved ones, particularly those of high esteem in our communities during this period of time. And I know this is cold comfort, but I hope for all those whānau who have lost loved ones at level 4 that there will be a time and a place where people can be properly recognised and people can properly gather.
Dr. Bloomfield, 2 nurses have contracted COVID-19, two nurses at Waikato Hospital. Why aren't you calling for mandatory use of masks for all hospital staff in all clinical settings and for the public right now?
So we've provided very good guidance to all our health workforce, whether it's inside hospitals or outside, on the use of PPE, including masks. And inside hospitals, I think you'll have seen there is quite wide use of masks, but the guidance is good. It's based on the advice of specialists, and likewise it's consistent with the advice from the WHO, and that includes the advice for the general public in terms of wearing masks.
How many staff and or patients at Waikato Hospital are now being tested for COVID-19?
There are the 2 nurses who are the cases on a ward, and that ward has been locked down, and the medical officer of health will make a decision about who needs testing. In that sort of setting, we would use testing of some asymptomatic people, including other staff members and possibly those in the wards as well, but I don't have the numbers as yet.
Guidance, as you say that guidance is good, but it's clearly not good enough if 2 nurses have contracted COVID-19.
What we don't know is where they contracted it, and it may be that it wasn't in the workplace. That's part of the investigation, is to look into that.
Prime Minister, can you say when definitively the election will be?
Sorry?
Can you say definitively when the election will be this
year? At the moment, we're sticking with the date that we have. Of course, the election period, the period that we consider for instance, for campaign finance purposes, is only 3 months prior to that. from our perspective, it is too soon. We're 2 weeks into a lockdown to make a determination of where we will be, even in a month's time from now. So it is something that we will keep under review, but at the moment we've kept it to this September 19th. I spoke to Simon Bridges just yesterday, just said that we would keep staying in touch over whether or not there's likely to be any movement there. And so ultimately it's in no one's interest to have a situation where we can't campaign as parties, but equally, I don't want to make a judgment yet that won't be able to happen.
What factors will you take into account when determining when the election will be held? Is it purely advice from health experts?
Sorry, is it purely advice from health experts? Well, of course the alert level you're in will make a big difference because we need people to be able to go out and physically vote. So that will be a significant determining factor. I think if we based it solely on the idea of whether or not we'll be able to have mass gatherings, actually that may be a fixture for some time. So I don't think that alone would be enough of a guide. So we really do need to just keep assessing New Zealand's position as we go.
Yesterday we heard from the Police Commissioner about a number of individuals spitting on police officers, hospital workers and other members of the frontline community. What would be your message to people that think this is acceptable?
I think it's appalling. And is particularly targeting people who are already making sacrifices for New Zealanders by being on the front line every day. I think it's appalling. I have other words, but I probably can't use them here.
Mr. For those people who go into quarantine when they get back, will New Zealand still be doing the regional flights to bring them to their hubs after the 14 days or
after? Yes, after the 14 days. So we recognise that after people have been in that quarantine, that they will need to get back to their homes, and often that will be potentially in the South Island if they arrived in Auckland. And so there will be the ability for them to use the regional airline capacity to get home.
Yep. How do they do that? I mean, they'll be sitting here wondering how on earth do they just go on the website, or what's the...
So this is one of the reasons why, of course, there is quite a bit to prepare around putting every single person who arrives at our border into a hotel. We do need to make sure that we're meeting all of their needs while they're there. Their food, of course, keeping in mind they cannot go to grocery stores. They cannot go and find essential services. We have to provide that for them. We also have to make sure that when they are looking to connect back to their home, that we're supporting them to do that. We will classify relocation after an international flight as being qualifying for essential access to domestic airlines.
Are you concerned about Airways' proposal to withdraw air traffic services from 7 regional airports?
Yes, so obviously part of our arrangements with Air New Zealand is to continue to maintain basic levels of connectivity with our regions. And so of course we'd be concerned if we're losing a fundamental part of that network. And so I know that's something that Minister Phil Twyford is aware of and is currently working on.
Is it reasonable given that they've claimed millions from the aviation package?
And this is one of the reasons that package existed, was because we valued and know we need to keep those links going, regardless of the fact that we're in alert level 4. We need to be ready to once again have lesser restrictions. So that's why Minister Twyford is working on this issue now.
Can you tell us about the number of foreign citizens in New Zealand who have now been repatriated, and the number still waiting to be repatriated, and the plan for them going forward?
So we still, I would say, in the thousands. We've got the number of German flights. We had the Netherlands working on flights, and for a time I also believe the UK. I would want to give you something a bit more up to date on that though in terms of numbers, but we've had a steady track of repatriations coming out of New Zealand. But they are still significant numbers as I understand, and including some foreign nationals who will need to transit through New Zealand if they are to get out of the Pacific, which also there are a number there.
So where does the government department...
I'll come in the front.
Is the government looking at wage support for people who are employed by government-funded organisations such as a cleaner at a council who's lost work during this time but isn't able to get the wage subsidy?
And sorry, your classification for why they couldn't get the wage subsidy? Because they're casual workers, or...?
Government-funded organisation.
Oh, well, so you're using the example of a council cleaner?
Yeah, the
question on behalf of someone else.
I wouldn't mind getting a bit more detail on that, because ultimately you don't get it as a government-funded organisation because we continue to fund you in order to operate continuously through this period. Others outside of that generally are able to access the wage subsidy. So I wouldn't mind looking at the example you've given. I've also been asked about casual staff. There is provision within the wage subsidy as long as an employer lists casual staff for them to be able to be included within the wage subsidy as well.
We've heard of government departments sending rent increase notices and chasing people for debt collection. Is that what you'd call compassionate?
What I will say on the issue of raised around Kāinga Ora, that was an error. That should never have happened. That was an automated letter that was dispatched. Kāinga Ora now are on the phone. They're making, I understand, roughly 2,000 calls to apologise to people who receive such letters because, as I say, it was automated. It should never have happened.
Do you acknowledge how distressing that would have been?
Absolutely. And absolutely I do. And that is why those individuals are being called personally to have that apology given to them and to make sure that people can have any concerns that they can talk them through with someone on the phone. It should never have happened.
Government departments chasing people for debt at the moment?
Again, I find that very surprising. If you give me the names of where that's happening, I'll look to fix it. Keeping in mind, though, if anyone is misusing the wage subsidy, we will go after that. So there is enforcement action happening at the moment, and there might be areas where it's, for instance, the government enforcing payments to others. So, of course, people through the courts who have to pay reparations to victims, or people who need to pay child support subsidy. That's not money to us, it's money much needed for other people, and so there might be some quirks in there.
For our sports team, golf courses want an exemption under essential services for green maintenance because they're worried that the results will be catastrophic and they have to shut down and not reopen. Why is it taking so long to get that looked at, and will you grant an exemption?
Because the reason that has taken time is that everything has to be viewed through a public health lens. I have had this raised with me. Officials are working on that issue as we speak.
On that, from Sir Bob Charles, he says by 4 weeks courses will close and never reopen. We need a small amount of maintenance to be carried out. Please look into this.
Yeah.
What do you
so
think of that?
What we have done in some areas where it is health and safety, in the sense that councils have said they want to keep maintenance because rodents become an issue, and then in those areas where it's just a single person, no contact with others, there has been the ability for that to be managed because our principles have always been maintain health and safety at the same time. When it comes to those recreational areas, public health lens needs to be our starting point, and that's what's being worked through now.
On the lockdown, there seems to be a little bit of confusion potentially amongst the public that at the end of the lockdown, it's life as usual again. Can you explain why that isn't the case?
When we're in the position to move from alert level 4, it will only be from there to alert level 3. So life will still be different. We do want to ease our restrictions, but if we move too quickly and loosen up too quickly, we will be back to the beginning. No one wants to be in alert level 4 longer than we need to, so that's why we need to be so careful as we exit it.
What are the criteria for schools reopening under level 3? What schools are allowed to reopen and what schools aren't?
Yeah. And so again, that's where I would question, we've obviously been preparing for distance learning, not because we think we'll be in alert level 4 for a long time, but because there may be different situations for different learning levels, so ECE, primary and secondary. The Minister of Education is again going over the guidelines that were set before alert level 4 to make sure that we've got them all nice and tight. And when we're talking next week about some of the specifics of level 3, we'll be including education in that.
Remarks, you mentioned that if we start to relax 2 weeks and then we could be back at the starting blocks. Have you been given advice that it could only take that short amount of time to
if we left now, yes.
Can you just also provide more information about the guidelines being released next week? How much detail can businesses expect there? Can they expect to be told who's essential and who's non-essential?
So what we'll do is work from the principles that we did for alert level 4, and that was keeping interaction with one another to a bare minimum, except for essential services. So we will use principles and then some examples. One of the issues is we have tens of thousands of businesses out there, and so often there will be questions that will come up even when we provide principles, and so we want to give enough time to work through some of those. So that's why we'll be releasing some of that detail next week.
Just going back on that 2-day notice period essentially that you're giving them to be able to ramp back up, they will say that is not enough.
No, just to be clear, that's essentially what we're doing now is say, everyone prepare for alert level 3. We'll be providing more detailed guidance on what that will look like next week. And then 2 days out from when we're due to come to the end of the 4 weeks, we'll be letting people know whether we are moving out or not. So that's the timeline we're working to. But if you wish to prepare now, and I'd encourage you to do so, the 3 basic starting points, make sure you look at whether or not you can work with social distancing. Can we contact trace all of the customers or your employees that you work with? And do you or will you need PPE? Those are some simple things that we ask people to already prepare for.
Has Minister Parker received legal advice from Crown Law yet regarding the Ruby Princess?
I've seen some. There is a bit more work to be done, particularly given this is primarily a customs issue, but work continues, so only preliminary at this stage.
What have you seen so far?
Nothing that I can share with you at this stage because it is only preliminary advice.
Singapore's app has been sort of criticised for needing a really high level of uptake in order for it to be effective. If you have half of the population using it, then you only track 25% of actual contacts.
Yes.
How do you get that uptake in New Zealand?
Well, ultimately, the decision is that we either have something that everyone is forced to use, or we have something that people voluntarily use, but we try and get as much uptake as possible. There are huge issues with forcing people to use apps that track their movements, as you can imagine. So we are opting for apps that people choose to partake in. But I think if people understand that it's one of the things that will help us stay out of stringent measures like Alert Level 4, then they might be encouraged to take it up. Ashley, did you want to comment on that as well?
Well, just to add that, again, the use of any technology, including the apps, will always be an adjunct to our core contact tracing functionality. The other thing that we can do, of course, is enhance our ability to get contact details for people by using
One of the things I'm going to be cautious about here is, even though you've asked about the law generally, this is a case that's been going since 2010, and my understanding is it could still be subject to appeal. And so it still needs to run its course, and then we'll be in a position to answer some of those questions.
Does it sit with you morally that the Crown can't directly be sued for negligence?
Again, asking me for a moral question when an appeal may still be coming, I need to let that run its course.
Hotels.
Yeah.
Where will those hotels be?
They're across Auckland, as you would expect. That is where we predominantly are having those international flights coming in.
Vans in Christchurch and Auckland as well?
So we do have camper vans available. We've been able to accommodate people successfully within hotels, but we have had the availability of camper vans should we need them. Keeping in mind that at the moment we have 40 yesterday, but on average in the past while we've had up to 190. You asked a question on why we didn't move earlier. We had things like Qatar bringing on extra flights. There is talk of some flights resuming, so some transit routes opening up for Kiwis. We have to constantly be prepared that those numbers might tick up, and that's why we keep that extra capacity.
That if there are people who have tested positive or who are COVID positive, that they're not going to pass that on in quarantine. What assurances can you give people that they're not going to get COVID-19 in quarantine?
Yeah, I'll hand over to Dr. Bloomfield, because Public Health are managing the quarantines.
So in that quarantine situation where someone is symptomatic and is being tested, or they have known infection because they were tested when they arrived, then that's very strict isolation, and any staff or people interacting with them are using PPE. The person's not allowed outside their room. Where it's that managed self-isolation, and what we are looking at is the extent of testing we might use for people coming in, and or testing before people are released. That's one of the things we're looking at. But again, we have experience now in being able to do this with the evacuees we brought out of Wuhan, and simple, religiously applied, hand washing, use of masks if necessary, and physical distancing will stop infections being spread.
The moving princess, you've said previously that 4 of the cases there were tour guides, interpreters or drivers. Now, I'm just asking, were all 4 of those in the Hawke's Bay, or were some from other ports that also hosted the cruise ship?
They were all Hawke's Bay, so it was they were local in the Hawke's Bay, and that's where we've seen the local spread is only in the Hawke's Bay.
Just on the clusters that are updated on the Ministry of Health website, the names of the clusters on the website are quite high level, but in the press conference you describe them as Mariscal, etc. Why is there a dissimilarity there? Why do you give more detail here and not on the website?
I think up until the last day or two there was that detail on the website, and for some reason it was downgraded or made more general, so we're reinstating it back to what it was.
We just want to incentivise you being here for these precious moments. All right, we'll just take the last couple. Yeah. Oh no, you didn't have one, Derek.
Will the use of an app given how important contact tracing is, will that need to be in place and voluntary uptake taken before we can move out of the level 4?
No, not necessarily. In fact, these, obviously, as I've said, this is something that's in train. It will enhance what we're doing, but given the imperfections in every country's app system that I've looked at, it will never be a panacea. It will never solve everything. That's why, as Dr. Bloomfield said today, we are auditing our contact tracing to make sure that we are doing everything that we can now to make sure that that is gold standard, and an app will only supplement that.
Shavira has talked about the need to be able to trace 7,000 people, contacts for 1,000 cases. Will we need to be able to do that before we can come out of level 4?
We would if we had 1,000 cases, but as you can see our case numbers are dropping. That's why we went into a level 4. We've got very good capacity there. In fact, we're not using all of that capacity now because the case numbers are dropping. And of course our intention is to get the case numbers down as low as possible, if not to 0, and then be able to stamp out any cases and any outbreaks that do perhaps pop up.
On those clusters, Dr. Bloomfield, are you able to give us more detail about, for example, the Auckland workplace that I think has around 25?
We will provide detail about, for example, the school or an event where it's pertinent, but in some instances we will withhold the name and location of the workplace if we think it's going to create privacy issues. That's the only reason.
It's a significant cluster. There's a large number of people affected by this.
And people who are affected get a phone call from the Ministry of Health, and so if they're affected, they know.
Stocks of PPE, and if so, why are Waikato hospital staff saying they still don't have enough?
Yes, I'm very happy with our stocks of PPE, and every DHB, including hospitals, has plenty of PPE. If there are individual staff members where they feel there is an issue, then they are and do raise it through their unions, and that's why we worked closely with unions to ensure that staff were confident, not just in the supply, but also in the availability and use.
Okay. Is the pandemic stock in good condition that can be sent out, or is some of it deteriorated?
Some of it has deteriorated, as we've found, and there was a story about that 10% of the masks, the N95 masks at Hutt Hospital, the elastics were found to have deteriorated and they have been replaced, but that doesn't mean there wasn't PPE available because it was only 10% of the stock there.
Okay, last...
or is that more widespread? Sorry.
There had been some other hospitals that we'd found earlier, but of course then we have plenty. We have another 18, we had the 18 million in our pandemic stock.
Last
So we
question.
could replace it.
How much is the government expecting managed quarantine to cost? And are we paying full rate for those rooms?
Oh, as you would expect, we are seeking to make sure that we maximise savings for taxpayers at a time when, of course, demand on hotels is very low. So while we're underway with negotiating some of those contracts, I'm not going to give a per room rate, but I can assure you we'll be seeking best value for money for New Zealanders. Again, it's purely speculative because there's such huge fluctuations in the numbers coming in every day, but I'm sure you'll be able to make some estimates based on the numbers that we have, keeping in mind also there's the cost of provision of food. Very last.
Prime Minister, I have a question from our Southern newsroom. The Bluff cluster, was it linked to international travel? And the cases were confirmed prior to lockdown, but the Ministry of Health was really slow to report this cluster. What was the hold up on that?
So 2 questions there. In response to the first one, yes, the index case was associated with international travel. And then secondly, it takes some time before the case numbers get up to a level where you've got a cluster, and then once they do reach that level, then of course we start investigating it as a cluster and then reporting on it as a cluster. So on that one actually there was quite rapid action, and also people came from around the country, so actually associated with that event there was a small cluster in Wellington, there's a larger cluster of about 25 in the Waikato, so they're all associated with that original event. And if I can just take a quick minute just to give you that accurate figure of the total lab tests to date, 51,165, and secondly we now have data on the laboratory testing by District Health Board and by ethnicity, and that includes both the rates and also the positivity rate, and we will be putting that on our website too this afternoon.
Okay, on that note, thanks everyone. Have a good weekend.